Professor, great to have you. What does a unified national strategy look like? Because in countries like the United States and even here in Australia, you're seeing a real divergence in the approaches going from state to state and on a federal national level.
Yes, thank you. Well, first of all, it's really important to understand that everyone's now beginning to realize that a plan of any kind has to be something that's going to last for months, not something that's going to be just a one-time hit. This is not like an earthquake or a tsunami where it's a short-lived hit and then you recover. And I think this has been a very big challenge to countries around the world to understand that, for example, right here in the United States, as bad as things are, we're just getting started.
It also means finding what a middle ground is, right? Here in Australia, you've got the government talking about a hibernation policy, incrementally shutting parts of the economy. Is there a true kind of moral question here as to what you do from a public health perspective and the implications for the economy, which then, of course, becomes more of a humanitarian issue?
Well, in fact, this is really at the very heart of what we need to be deciding today as far as national plans. And we have to understand what it means to have coronavirus here in our countries. First, this is not going to get over with anytime soon. Even those who suggest that there may be seasonal changes in the disease incidence, whether it's your winter, our winter, whatever, there's no evidence that that's actually going to happen. This could continue to roll on for 6 or more months. We're still seeing case transmission in China 5 months into their outbreak, and which they have done really, truly the most unprecedented population limitation requirements anywhere in the world. So they have to get prepared for that. And so your point's a really good one. Do we lock down for 8, 10, 15 months more until we may hopefully one day have a vaccine? That will not just cause economic disaster, but we have a world that needs to have its people that pick up garbage, that take care of people in the healthcare settings, that are fire and police, groceries, etc. We can't just completely lock down. On the other hand, if we don't do some very dramatic things, we will overwhelm every healthcare system in the world. And not just overwhelm it in a way with these patients, but it means that people who normally would seek healthcare, people who have heart attacks, people who have cancer, people who are injured, they too will not get services. So we need to thread a middle ground. And that's what we're trying to achieve, is how do we release a segment of our population, particularly those at the lowest risk of having serious disease, to continue to operate the world as we know it, but at the same time shelter in place as much as we can those who are at higher risk of having serious disease and dying. And it's threading that needle, I say, with the rope that we need to do.
So, Michael, when do you think we can get to that point where you can isolate and quarantine the high-risk populations while letting some of the other populations that have either tested positive and recovered or were tested negative for coronavirus support the economy and let those people get back to work and push us forward?
Yeah, thank you. You raised a really very important point, too, is that as more people become infected, 2 things happen. One is, first of all, once they recover, are likely immune for a foreseeable future. They can be out in the public. They're the ones that can be interacting with anyone and not worry about getting infected or transmitting the virus to someone else. The second thing is they kind of become what I would call a rod in the virus reaction, meaning if you're not able to be infected or transmit the virus on, the more of those people like that is going to slow down the virus spread. So clearly we have to understand what it means to be able to bring these people back into everyday life and use them as really very important members of the community to stop virus transmission and to live with it. I think the other point, though, that really needs to be considered here is that who is at high risk? And we're now getting data emerging out of the United States that is in contrast to what we saw in China. There we saw older men and women, primarily in smokers, who had the highest risk. And in China, over 70% of individuals 65 years of age and older smoke. We don't see that in the United States or in Australia. But what we do see is an epidemic of obesity. And well over 45% of the U.S. population, both men and women over age 50, are obese. And right now we have data coming out of New York in particular that suggests that obesity is a major risk factor for also having a complicated infection and one where you may be more seriously ill and die. And so one of the things we're going to have to be looking at carefully when we make recommendations about who is it that we need to protect the most, we're not clear on that yet. And we can't use data from just one country because the underlying conditions will vary in terms of their prevalence or the frequency with which they occur by country.
I want you to give our audience a lesson on utility theory. John Authors, he's one of our Bloomberg opinion columnists, highlighted utility theory, where you maximize happiness and wealth of the most population that you can. And yet I read through your opinion piece and it says pitting human life against long-term economics presents a false choice. Why is that a false choice?
Well, it's a false choice because, in fact, the world's health is in part tied to economics. When there are down times, when we are in recessions, we're in depressions, we actually see increased occurrences of serious disease problems because people aren't able financially to access health care, or they're in a position of depression where we see more mental health problems occur. And at the same time that we have these problems is when we actually need to have people be able to be part of the everyday life of picking up garbage or of making sure that in metropolitan areas that elevators work or fire, police, food, etc. So it shouldn't be a choice one or the other. It's how do you integrate the two, meaning we have to not only deal with dying with this virus, but we also have to learn to live with it. And I think that's what's an important message here is how do we do that in the most effective way so that in 18 months or more, when we have a vaccine and we come out of this situation, we have done the most good for the most people. And that's what we need to really concentrate on today to actually maximize both the health and the economy. They are one and the same in many ways.
To be able to get that level of confidence that we can reopen the workforce, that we can reopen the economy, we need to have a reasonable idea of immunity, as you said, right? Are we going to get that without very widespread standardized testing everywhere?
Yes. Well, first of all, to talk about getting that immunity, what you're really, in fact, is stating is that we have to have a test to know. Have you been infected? Are you now protected? That is what we call an antibody test. That's actually a blood sample that's taken that then is a different kind of thing than the throat swab you're seeing now, which is looking for the virus. We need to make sure that we have those tests available. We don't yet. And then when we do, we have to make sure that they're produced in the kind of volumes that the world is going to demand. Right now, we are running out of testing reagents for the detection of the virus itself, the kind of thing looking in the throat swab. And it's a real challenge for us to say even who's infected in my own home state here of Minnesota in the United States. We're very, very limited who we can test because we don't have enough tests available. Why? The global supply chains just collapsed in a sense because everybody in the world all at once wanted it. In part, the China contribution to reagent manufacturing, the chemicals that we need to do these tests is substantial, and they've been down. So we do need to get these antibody tests available so people can know, have I been infected, am I now protected? But it's not going to come anytime soon, meaning it won't be tomorrow, next week, or next month, but surely we need them soon.